Lions defensive end Aidan Hutchinson was carted off with a severe leg injury today against the Cowboys. Let's break this down. Anytime you see a player in these air casts or splints on their legs, you can assume there was a joint dislocation or a serious fracture. We saw some friendly fire here as Hutchinson is trying to sack Dak Prescott. When he wraps him up, his left leg swings around and it runs into the shin of his teammate. This contact comes from the lateral side and unfortunately appears to shatter both the tibia and the fibula of the lower leg. First concern here for doctors is the blood vessels and the nerves. This area here is where the popliteal artery breaks off into the tibial and fibular arteries, and also where the tibial nerve runs through. These are important to preserve in order to avoid limb loss. We do this by grossly reducing it back into its normal alignment and getting it splinted or casted. Once stabilized, getting the athlete straight to the hospital as soon as possible. Another big concern is if this was an open fracture or a compound fracture. That's where the bone is coming out of the skin. You're pretty concerned about an infection, and these can be more complicated. These are usually treated with an intramedullary nail. Occasionally these do require surgery on the fibula as well. Though this is certainly a season ender, barring any major complications, these type of injuries can have better long-term outcomes compared to something like an ACL injury, and the hope would be that we see Aidan back out there next year. Wishing him a safe and speedy recovery.